Welcome to your OncoCare Advisor. This is Dr. Raghav again here. Someone reached out to me and they wanted me to talk about basics of colon cancer. Actually, no, it's a good time to talk about it because we haven't talked about colon cancer in a while. So, colon cancer, let's start with very, very basic information. Let's define what is colon. So colon typically means large intestine. So we have stomach, small intestine, and large intestine. So colon is basically meaning large intestine. It also includes rectum. So that's the definition. Occurrence, that means what is the prevalence of it, like, how often do we see this? So usually colon cancer is considered the third most significant cancer leading to death in both men and women across the world. But it is reducing. You mean the mortality? That means the number of people dying from colon cancer is getting lesser because of better screening. We'll talk about screening in a while. Then if you also look at the next factor, which is how do they start? Colon cancers most times starts in a polyp. That polyp can be a little projection inside the large intestine, and usually takes years for it to grow from a simple polyp to a cancer. Now let's talk about the risk factors. This is very important because this is a way to prevent and to detect early. The risk factors typically include general risk factors like age, smoking, less physical activity. Not by itself, but less physical activity indicates that their general health status is lower. So in some ways, having an exercise regimen helps with the general health of the person. So age, smoking, lack of physical activity, family history, if someone has a family history of colon cancer or stomach cancers, etc. And high fat and processed foods. And lastly, some history of ulcerative colitis or Crohn's disease, or mostly ulcerative colitis. These are some of the risk factors. But the best way to prevent or find colon cancer early is by screening, usually colonoscopy. So another question I got from a person is, how do we identify what kind of symptoms we should look for, or we should see, or we tend to see? I think it's very important because I'll first talk about symptoms and later explain about how these symptoms can differ too. The symptoms can be very generalized. Generally not feeling well, tired, anemia, bleeding in your bowels. That means like when you go for a bowel movement, you see either bright red colored blood, or pain in the abdomen, or feeling pain when you are actually having a bowel movement, etc. But these are very general symptoms. If I dive into that a little bit more deeply, the symptoms can vary depending on where the colon cancer is starting. Now let's tease that out further. So we talked about large intestine. The large intestine is very large and it is long. So it has at least 3 to 4 components to it. The first step is ascending colon, or cecum. Cecum is a junction between the small intestine and the large intestine. Let's leave that aside. Ascending colon, transverse colon, descending colon, and in the part of the descending colon, the sigmoid colon, basically meaning it's S-shaped, and rectum. So ascending is usually on the right side of your belly, descending is usually in the left side of your belly, and the transverse colon is across the connecting both. So with that information, what we understand is where the cancer starts will cause symptoms accordingly. So if the cancer is starting in the left side of the colon, meaning the ascending colon, the symptoms happen usually later. That means even if they're bleeding a little bit, it takes longer for the blood to come through the colon in the bowels. So it takes longer to present the symptoms. That means it stays there longer, meaning it has a chance to spread because of the time duration. If the cancer starts in the lower left side of the colon, then the symptoms tend to appear a little bit sooner, like mostly bleeding. That if there's a bleeding, you will notice the blood in the bowels. If the tumor is larger, it causes pain. If the tumor is small, it may not cause any pain. So it can vary. Rectal cancers, on the other hand, has a different behavior than a colon cancer. So rectal cancers tend to present more with pain, bleeding, and tend to present a little bit early, but their spreading pattern is also different. Hence, we treat them differently. We'll talk about that in a later post, but let's summarize what we talked about in terms of the colon or colorectal cancer. First thing, it is a very common cancer. It's still a very deadly cancer. 2, it is preventable and treatable if found in the early stage, meaning is reducing the risk factors and getting the colonoscopy done to find it early gives a very high chance of cure. And 3rd, knowing about it and being aware of it will help you navigate this much better. But what you got to do is look at your risk factors, look at your family history, and see how you can reduce your risk of colon cancer. 2nd, get screened. Talk to your doctor about it. We'll talk about more how you screen in the later post. And 3rd, spread awareness of colon cancer. That's the only way we can reduce the risk of colon cancer and reduce the deaths from colon cancer. So I hope this was helpful. If you have any other topics you want me to talk about, please DM me here. Happy to address them. If you have any other questions, please reach out. Thank you again. This is your Oncocare Advisor. Subscribe and follow.